How often should newborns pee and poop? If you're a new parent, you might be wondering how often your newborn should be peeing and pooping. Let's break it down to help you understand what's normal and what's not. First, let's talk about peeing. Newborns can pee as often as every 1 to 3 hours, or as infrequently as 4 to 6 times a day. This wide range is completely normal. In the first 24 hours after birth, your baby should pee at least once, and by the end of the first week, they should be having around 4 to 6 wet diapers a day. The color of the urine is also important. Healthy urine is light to dark yellow. If it's pink or brick red, it might just be highly concentrated urine, especially if your baby is not drinking a lot of liquid. However, if you see red, orange, or brown hues, it could indicate blood, which is not normal. Now let's move on to pooping. The frequency of bowel movements varies depending on whether your baby is breastfed or formula fed. Breastfed babies typically have several bowel movements a day, often after each feeding due to the gastrocolic reflex. They might have anywhere from 3 to 12 bowel movements per day in the first few weeks. By 3 to 6 weeks, some breastfed babies might only poop once a week, and that's still normal as long as the stools are soft and your baby is otherwise healthy. For formula-fed babies, the expectation is a bit different. They should have at least one bowel movement a day. If they have fewer than this and appear to be straining, they might be constipated, and you should check with your pediatrician. In the first few days after birth, both breastfed and formula-fed babies will pass meconium, a dark, sticky stool. This should change to a green-yellow color by around day 4. After this, the stools should be soft and runny for breastfed babies and light brown or greenish for formula-fed babies. If you notice any unusual signs, such as maroon or bloody stools, black stools after the meconium phase, white or gray stools, or stools with a large amount of mucus or water, you should talk to your pediatrician right away. These could be signs of an infection or other health issues. In summary, keeping an eye on your newborn's peeing and pooping habits give you a good idea of their health. If you have any concerns or notice anything out of the ordinary, it's always best to consult with your pediatrician.